All right, in our previous segment, we talked about the political censorship imposed by social media giants in the coverage of the Portland riots and kind of what's behind all of this lawlessness. But that censorship is expanding into the medical field. It's already been there, but yesterday was a blatant example. I was invited to attend a meeting on Capitol Hill. I couldn't be there. But it was a meeting of doctors holding a press conference about the coronavirus. In fact, it exploded across social media, about 17 million views, I think. But Facebook, Google, YouTube, Twitter all began to limit the access to the video. Why? Well, joining me now to talk about this is Dr. Teryn Clarke, one of the doctors who participated in yesterday's event. Dr. Clarke, welcome to Washington Watch.
Thanks so much for having me.
So why the interest? I mean, 17 million views. It was the top performing video on Facebook. What's the interest here?
Well, people are desperate for real information about this virus. Numbers are starting to look like they don't add up. People are living in fear. There have been a lot of deaths, but recently more of the people who have gotten or tested positive with this have not had symptoms. They've been younger, healthier, and recovered more quickly. So I think there is really a curiosity in our society of, well, it's not looking like in my community like it's supposed to look and like it looks on the news. So
right.
What's the story here?
I think that's so true.
We're just desperate for answers.
I think that's absolutely true. I mean, I've just recovered from the coronavirus. It was not the death warrant that some would have you make it out to be. My daughter, who's an ER nurse, been working in the COVID unit since it began, and she says one of the biggest things that happens is people come in, they're fearful, and as soon as they test positive, they ask if they're going to die because of the media message that has been out there. So that being the case, people want information. People need information. We know now there's enough data that's being compiled that it's not what we first thought it was. Still bad. Why the censorship of the information?
I wish I had an answer. I mean, it was shocking. I mean, first of all, I was surprised that we got so much attention because our intention with coming here was, we're hearing from a lot of policy physicians, and America needs to get the message from their doctor. And if their doctor isn't keeping up on the literature, which is just coming down in dumps, there's so much of it, we wanted to speak directly to people, to say, talk to your doctor about this. Here's what we're seeing on the front lines. So we were, first of all, surprised that there was so much attention. Immediately, we had, as you said, just millions and millions of viewers. And then we were equally surprised when we woke up and all of it had been taken down. Actually, the website that was set up for this conference about a week ago has also been taken down by the web hosting service. And what was posted there was just that this conference was happening, and then links to all the studies that have been done on hydroxychloroquine early in the disease. There were also links to, for example, an NIH research paper from 2005 showing that chloroquine, which is related to hydroxychloroquine, was effective in SARS-CoV-1. And so, that's interesting because SARS-CoV-1 and SARS-CoV-2 are about 78 to 80% similar in their RNA. So I don't know how it's controversial that we're looking at an NIH paper when at the time Anthony Fauci was at the NIH in 2005. So, to make it seem like it's controversial, and we still see the mainstream media saying, it's not been shown to work, it's shown to be dangerous.
Dr. Clarke,
it showed it's dangerous.
Dr. Clarke,
yeah.
All of you that were there yesterday are those that have front lines. That describes who you've been working on this. It's not like you're a group of quacks that just want to get media attention. You've actually been working with patients. You've seen them recover. You've treated them. I thought medical science was about science and discovering the facts.
I thought so too, and I really thought that once the facts were out there, this would self-correct. And that became evident maybe a little over a month ago that the facts were being ignored. And we've never seen studies that were done in these huge journals, Lancet, New England Journal. They're highly respected. They're some of the best medical journals in the world that rapidly publish things. I don't know what broke down in the peer review process, but it was shown that the data was actually fraudulent. There was no real data it was based on. it came from a third-party company that couldn't verify it, and the studies were retracted. That never, I mean, I don't remember in my career that happening. So it just seemed like, well, those were the studies that showed it was unsafe. There's another one where they used toxic doses of the medicine, and not surprisingly, at toxic doses, the medicine is toxic. So it really is safe. I mean, I was referring people today to the CDC's own website. And if people go to the CDC website and look at malaria prophylaxis, hydrochloroquine, there's a whole 2-page fact sheet, and they list the side effects, nausea, diarrhea, and we do see that. It does cause stomach upset. They mention nothing on there in these prophylactic doses, which is what's recommended in COVID, of, heart concerns. You need to get an EKG first. I mean, you'd be very, very reassured reading about this medication on the CDC's own website. And yet we're being vilified and our information is being taken down because we're suggesting, that this is an option. And the mechanism of action of this drug we've known for 60 years or so. I mean, this drug has been around a really long time. And so we know how it stops things from getting in the cells. We know how it blocks the replication of foreign invaders that get in the cells. So it's not a mystery. It's not unsafe. It's effective when we use it early with zinc. It's not effective late or without zinc. So, cherry picking the data and the studies as they have been and still continuing to just say not effective, not safe, that's not true.
So, Dr. Clarke, I know I'm going to ask you a question that's outside your professional field of training. You're a medical doctor and you're dealing with the coronavirus, but you said you've never seen anything like this, even when it comes to the professional journals. I mean, could it be that there is a political agenda behind the coronavirus and some people just don't want it solved?
I mean, I don't want to believe that, but in trying to find evidence to support that that's not the case, I'm not coming up with much. And I think that silencing us, I mean, I don't know how it could be seen that what we're saying is dangerous. Why would that be dangerous? We're a group of under 20 physicians that came on the trip. There are a lot of us at home that couldn't take the time off and fly here and spend the time. But, we're across multiple specialties. We don't have a dog in the fight. We have nothing financially to gain from this. I actually don't want the media attention. That's my preference would be to just be a little quiet physician doing my thing, like I usually do. So we're motivated because we want to help people. And we want to get through what some of the medical boards are doing with physicians, what they're doing with this medication. Pharmacists refusing to fill the prescriptions. I've never been questioned about a prescription. I mean, I could much easier write a prescription for probably like a crazy amount of opioids and get less pushback than I get on this, for 20 tablets of this medicine. It's a very small dose. It's not dangerous. And that's also unprecedented.
Wow.
We often use medications off-label. We use medications even against some warnings because we don't have any other options. And we explain that to patients and they understand it. We still don't get calls, So generally the pharmacists understand that we make these difficult decisions with our patients. But in this case, it's very unusual behavior. In the medical community, the medical board's been weaponized against physicians. They're afraid to speak out. It's part of the reason it's hard to get people to come on camera because you see what's happening to us on the web.
Wow. Disturbing.
It's a crazy time.
It is disturbing.
Yes,
thank you for being willing to participate and publicly talk about your experience with the coronavirus as a physician. And thanks for coming on today to Washington Watch.
You're welcome. Thanks for having me. Take care.
Absolutely. Dr. Teryn Clarke. And by the way, I'd mentioned that the rationale that Facebook gave for removing this video, which 17 million people had watched, was that they use as their standard the World Health Organization. And so they basically, their myth-busting organization is the World Health Organization, which the U.S. is moving to defund. The president was defunding it because they provided the cover to China, giving them time to try to cover their tracks. In the meanwhile, the virus spread globally. And I thank the Chinese for the fact that I spent 2 weeks with the coronavirus.